And it is time to talk with our 7 News medical expert, Dr. Cedrek McFadden. As we get more questions from you guys on Facebook, you can always add to the list on the 7 News Facebook page. Eloise is asking today, I take a blood thinner, statin drug, and insulin pill. Is it okay to take them? I don't really go out, but 2 to 3 times a month, and I wear my mask.
So not only is it probably okay to take these medications, it's probably necessary that you continue to take them. If you're not taking your medications for diabetes, that certainly sets you up for risk for higher complications from not having your blood sugars tightly controlled. So yes, you should be taking your medications. You should continue not to hold them. Make sure you have the adequate supplies on hand.
And always talk to your doctor before you do any kind of change.
Absolutely.
Right there.
Do not make a unilateral decision to
by
hold
yourself.
or change the doses of your medications.
Jesse is asking, could you ask the doctor if someone has a cough and has had it since around December and fatigue, should they test themselves for the virus?
All right, so that's a great question. I'd first of all be concerned if you're still having a cough since December. I think there are other things that could be going on. You could still be having allergies. You could still be having other pulmonary problems. So you definitely want to talk with your doctor, and not necessarily mean you have the coronavirus, but there may be other things that you need to be testing for.
Jeanette and Lisa both talking about this particular issue. We're not even close to the peak here in Greenwood. She says, why are we fixing to open? And Lisa saying, are we opening too soon?
So that's a heavy question. That is a heavy question, and I think a lot of our, local and state officials, they're making those decisions based on the information they are receiving. What's important to remember is that regardless of when we open up as a state or as a city, we still have a personal responsibility to clean our hands, to maintain social distancing. Just because things are opening doesn't mean that we all have to flock out to wherever things may be open, like the retail stores. And so I still think that as we live this in real time, we'll learn more as we proceed, but we still have personal responsibilities.
I mean, if we pull up to a store and it's packed with people, it's probably a good idea to maybe come back at a less busy time.
Correct. I don't think we'll ever look at crowds the same way again. I think we'll always sort of look at how we greet each other and how we respond in situations like that. So still take that personal responsibility even if we're opening up.
Mahalia asking, everybody's concentrated on washing hands. What's the proper way to wash your face, eyes, and blow your nose?
Yeah, so when you come in after a long day, you definitely want to clean your hands. You definitely want to take that time to sanitize. If you're washing your face, obviously, after you've cleaned your hands, you're likely okay. And then blowing your nose, the same thing. We should be constantly throughout the day cleaning, sanitizing our hands. And when you're using tissues, such as needing to blow in your nose or coughing or sneezing, you want to properly dispose of them in a trash can or receptacle.
And wash the hands when you're done.
And washing the hands when you're done.
All right. Dr. Cedrek McFadden answering your questions as always. Of course, if you want to add those, you can head to the 7 News Facebook page, and we'll tackle those on Thursday. Thank you.